would like to introduce Dr. Jamie Gallion with J. Clayton Spine and Health. Welcome, Dr. Gallion, and
Hi,
thanks
Dawn.
for being here.
Thank you for having me.
Absolutely. Let's just start with a little bit of an update about who you are and tell us a little bit about the business.
Yes, I've been practicing for 30 years. I've had a practice here in Greensburg since 2001. Haven't really practiced up here. We've had several offices that I've been basically in Seymour or Scottsburg. But we'd sold it a couple of years ago, and then I ended up buying the practice here in Greensburg back.
You loved us so much you were coming back.
You know, I've always liked Greensburg. My brother works here. I have a lot of family that lives in
Perfect.
Westport, and then we live in Scipio. So we've always came up this way. It's just kind of a natural fit. I like the people here. They're kind of what I consider kind of who I am in reality. And then, but no, I just this is my 30th year of practicing. We've been able to have some good practices over the years, and I look forward to being in this area, and this is probably where I'll retire from.
Awesome. Well, we're happy to have you. You mentioned Scipio. Tell us just a little bit about you personally, because I've picked up on some things that you like to do in your spare time. Tell us a little bit about that.
Well, I was always I was raised in a cattle farm, and
Okay.
my uncles always had crops and stuff, so I was always on the field and always in raising cattle. I was in 4-H for 10 years. I enjoyed that, and when I went to college, I swore I'd never go back and do anything at the farm again.
Oh,
and
don't you know the rule? Never say
I
never.
know, and then we just started missing it, and
Yeah, absolutely.
so we ended up, my wife and I bought a farm in Scipio. It was my grandfather's farm, and we started growing it, and now we're up to about 150 head of cattle, and we bought our bulls here and from Greensburg, and that's worked out really well for us at Stewart's. And so it always is nice, because when I get all these old farmers coming in here and they say, well, I've been out on the tractor, I know exactly what they're talking about. I know it moans and groans and aches, and then we've cut a lot of wood, and I've worked in factories to get through school, so I kind of understand what people have going on when they come in.
Sure you do. Yeah, firsthand experience. And so cool to be able to relate to your clientele that's coming in, because you can say, yeah, I feel it too, I understand.
Oh, yeah.
And I know how to fix that, or I know how to help you.
Yeah, I mean, we're always out wrestling cattle, or, you know, throwing somebody around, and so I'll have a patient come in and they'll say something very similar. I'm like, well, yeah, I know exactly how that feels.
Sure.
You know, and I've gotten older, and they, you know, I've gotten more aches and pains, so I kind of know what patients feel like and what they're going through, and then we have a great ways of being able to help them.
Yeah, perfect. You definitely need to attend that Ag Day breakfast
I
coming
was
up.
thinking about
I
that.
bet you're going to have a lot of friends that are going to be there.
Yeah.
So yeah, awesome. Well, as we're talking about that industry in particular, we've mentioned the Ag Day breakfast, of course. Let's talk a little bit about what services your office does provide and how it can help those people that we just mentioned. I know that's just one small demographic of the population that you serve, but talk a little bit about some of those services.
Well, we have another chiropractor in with us. His name is Dr. Eric Lutz, and he went to Logan, which is a little different school than I went to. I went to Palmer. So Eric is really good. He does a lot of dry needling, a lot of stretching. I mean, he's a really good adjuster. He graduated, I think, 4 years ago. So he's been a great addition. You know, high energy. You know, we're both licensed physical therapists. When you go through chiropractic school, you become a physical therapist.
Okay.
So he does a lot more stretching and things that I do. I'm kind of more the old school, where I do more of the adjustments. I adjust from babies all the way up to elderly. We have different techniques where we can use what's called a little activator technique. Dr. Basilio, who was here, I was good friends with her, and she used the activator technique. It's just those are things that we've kind of been able to work with. We're completely opposite of how we practice, but we work together to try to fit the person what roles that they might need, or who needs what.
Yeah, and what a great balance, you know, that you've both got different techniques, and one may work for somebody, or you know, you may be lent to trying something or not trying something, and the fact that you can offer all of that within one office is
we tell the
pretty cool.
patients, we're just going to put you who you feel most comfortable with, and if it's not working with him or if it's not working with me, we'll switch off and see if we can help. And
sure.
we also have 2 nurse practitioners there.
Okay.
That's great. The one worked in the pain management and ER for 15 years. She does a lot of injections for us. Very, very qualified. I've been trying to work with her for 20 years. She's been a patient of mine for that long. And so it finally has worked out that she's actually comes to the office now. She's fantastic. And then...
So she's not there all the time?
She's only there on Thursdays.
Okay, on Thursdays.
And then that's Sarah. And then Beth is our other nurse practitioner. And she's worked in the ER. She's done a lot of similar things as what Sarah does, but she's kind of taken a little different route where she does more cosmetics. She does more of the Botox and the Juvederm and Dysport and those types of things.
Very interesting, because I bet a lot of people listening, including myself, didn't know that you provided those services.
Oh, yeah, she's fantastic. She has her own salon in Seymour, and again, we've known her for 30 years. So I recruited her to come help me get this started, and she's been a huge asset on getting that going. And then she really helps us with the weight loss program too. So we've been doing weight loss for about 10 years in our clinic, and Beth has really kind of dove into it. We offer different types of weight loss programs based upon when you come in and kind of tell us what your story is and what you want, what's your goals. Then we kind of customize that around what you're looking for and set goals up to where we can meet those goals.
Perfect. So it's making a lot more sense now to me as we're talking about all the different services and how broad of a spectrum that truly is. The name J. Clayton Spine and Health, that is that health piece and that initiative. So very, very, very cool. I have talked a little bit with you in the past about some of the other things that you offer as far as services. Tell me about ozone therapy.
So ozone therapy is really interesting. This is something that we kind of came about recently. I really had never heard of this till we went out to Oklahoma City.
Okay.
And we took the whole staff out there to learn more on projects from this doctor who's fantastic. He's very well known. And we got out there and he was talking about this ozone therapy. And it was kind of crazy because I've been doing this for 30 years, never heard of it, other than the atmosphere of ozone.
Sure.
So as we started learning from him, we learned that ozone has been around for decades. Ozone was in most hospitals in the 40s to deal with pneumonia.
Okay.
And it was super effective. So ozone kills bacterias, funguses, parasites, and viruses. So on contact. And for example, like the Los Angeles Water Company, the way that they filtrate their systems is that they filtrate out the solids, and then they do this technique called reverse osmosis to get rid of all the meds and the medications and stuff.
Okay.
But then they use ozone and ultraviolet light to go in and purify the water. So it's one of the purest waters you'll drink. And then you think of Los Angeles, you don't think it's very pure. Right. At least I don't. But it's very pure. They actually have to add back vitamins like calcium and phosphorus because it's so pure that if you drink it the way it is, it'll kind of leach it out of your bones. So it's really, really interesting. They use a lot. They were doing a lot of cancer therapies out there where we went, which I had no idea that's what we're kind of going into. And my wife had recently went through breast cancer.
Okay.
And sorry. And so when we started going through this, she had bad knees. It was really bothering her.
Okay.
And so it was ever since she had the chemo, it was just she had a lot of joint pain.
Right.
And she did the ozone treatment, and it was like an hour later. He's like, She says, I have no pain in my knees.
What? Very incredible, very incredible. It is a little bit of an emotional moment here, something that is very near and dear to his heart, as you can see. And he actually has his wife in studio with us today. I'm kind of watching both and watching reactions, and I think from what I'm gathering from the story and the reactions is it has been a very turnkey treatment for the both of you.
Oh yeah, it's been very good. It's been helping her with her pain, but it's also proactive on trying to reduce body inflammation. It helps to increase your immune system by killing off the viruses, bacteria, things that we acquire.
Okay.
And the other thing it does is it helps to stimulate the mitochondria, which is the powerhouse of the cell. It gives the ability for the mitochondria to work better, so you have more energy with it. So just things that you learn, you know, it's quite
interesting.
There's
Yes.
not very many people doing this. I mean, we
Okay.
looked it up. There's like 250 people, practices in the nation that are doing this, which I just thought was, part of me I thought was great because I'd never heard of it.
Right.
But the other part of me is like, wow,
It's
how has this been around for all these decades and nobody knows about this?
Right.
So I think there's a lot of things we'll learn as we go through this. I don't think it's like a golden goose or anything, but if it helps, let's try. Let's see what we can do.
Yep. Okay. And so that therapy, the ozone therapy, you do offer in your office currently, correct?
Yep.
Okay.
And we do it with UV light too. So actually, you take a little bit of blood out of your body, about 60 cc's. You put it in a saline bag with ozone, and it's kind of funny because it turns like a really dark red to like a really kind of really pretty red. And then you drip it back in just like an IV infusion, and that's what it goes back in. And it takes about 30 minutes to do it. So
how would somebody, okay, so if somebody is hearing this report right now and they're like, that's interesting, what technique or that technique works on what?
So it's kind of amazing. He uses it for, when we went out there to Oklahoma, they were using it for lots of stuff. I mean, they were using, a lot of it was for pain management.
Pain management.
Because
okay.
their inflammation was so high throughout their body. And then they were using it with cancer patients. If they were people were really ill, I mean, I encourage people to get on YouTube and just look it up. Because it is out there everywhere. I mean, you pull up YouTube and ozone therapy, I was shocked. And ultraviolet light, how much information is really out there and people have utilized this.
So interesting. You mentioned ultraviolet light, and then we talked, I think at the very beginning, I think you mentioned IV therapy. Tell me a little bit about that technique.
So IV therapy is just basically you're just getting vitamins through there. When you take a vitamin, your goal is to get at least 50% absorption with it. I mean, that's what you want, and that's a really good vitamin. A lot of times the vitamins have a coating that's really hard to break down, especially as you get older. But the IV therapy, whatever vitamin you have directly goes into your bloodstream, so you're getting 100% of the vitamin. So that's what you really want if you're gonna do it. You want to get 100% of it.
Sure.
And so people that there's lots of reasons people come in. One of them is try to boost your immune system. When COVID was going rapid, we did a lot of IV therapies just to try to boost their immune system. When we had the long COVID, we had a lot of patients with that come in because they just felt miserable. So we did IV therapy with those patients, and it seemed to help some. It's just like anything. It doesn't help everybody, but a lot of people it helps. So offer it, and then. I mean, we've had patients that came in with hangovers. It's crazy. It works for hangovers because you're just putting different vitamins in them to get them boosted back up. I think it's more of the saline, just getting them hydrated.
Right,
again.
sure.
And then one of the things we found out with Jeannie when she was going through, my wife, when she was going through all the breast cancer, is after her chemo treatments, she would get really sick, of course.
Okay.
And so we started using the IV therapy with her, just basically putting saline with a little bit of magnesium in it, and she did. I mean, the doctors were shocked how much better she did, just because she was hydrated. And I just think the hydration is, people that go through chemo, they don't feel like doing anything. They feel like eating or drinking or anything. So she, I think just having that drip in her and giving her a couple of bags of IV just got her over the hump much quicker than others.
Yeah, awesome. I've also got a note here that you also offer regenerative therapy. Tell me a little bit about that.
Well, that's why we went out to Oklahoma City for, was regenerative therapy. And
you went out for regenerative therapy, came back with ozone therapy.
Well, we got both. I mean, they do this in contrast because actually we use ozone therapy when we're doing the regenerative therapy. So the regenerative therapy, it used to be called stem cell injections. I can't say that anymore. So we have to say it's called exomes. So exomes, basically you are using donated placentas, and you use the umbilical cords, and there's certain areas of the umbilical cords that has a lot of stem cells in them. So you harvest those exomes, and then you actually inject those into. We're only doing knees right now, but we've done them in shoulders and hips and everything. So at the other practice I was at, we had done probably close to 100 of those, and we had really good results. And I just felt like there was a better way to do it. So when we went out to Oklahoma City, those guys had been doing it since 2006. So I knew that their practice was huge. I mean, so we learned a lot from them and different techniques on how to do that. So basically, what the exome is basically it's a cell that has no identification yet. So when it touches like cartilage or like a lubrication, it just helps to increase the lubrication and the cushioning of the joint. That's the goal.
Okay.
That's what you try to do.
Okay.
Mm-hmm.
I am learning so much today. I'm looking over at Sandy, and her eyes are about as big as silver dollars. Like, did you even know that all this was available, Sandy, in Greensburg, Indiana? Very cool.
What's really cool is we started using the ozone into the injections with the knees, which was really cool because it acts as an anti-inflammatory right away. So my mom just got this last Thursday, who I've been trying to talk into coming in and getting injections for like the last couple of years, and she just, it's your mom. You're never going to convince her. So finally, she hurt bad enough. She's like, okay, I'm either going to get a knee replacement or, let's try this.
Sure.
So I'm like, okay. So she tried it. This was Thursday. So we go over to her house last night, and I'm not saying I'm not saying this is a miracle or anything like this, but she's like squatting down, grabbing her knee, pulling it up. She's like, I put my pants on correctly. It's like, I don't know how you've been putting them on before, Mom. I don't really want to know. But she was tickled to death that she basically had no pain in her knee. And she has had pain in her knee for years. So,
she had the regen
injection, which was the exomes.
Yep.
And then as you have the needle in there, you add like 10 cc's of ozone. It's a gas that you just put in. And that helps to reduce the inflammation. But the really cool thing about that is the ozone kills viruses and bacteria. So there's usually, good chance that you're not going to be able to get some type of infection. Like if you have a knee replacement or something, sometimes you'll get you'll get infections with those. It just happens. I mean, be as clean as you can, but sometimes that happens. So we've done a lot of patients that with the injections that's been told that they have a heart condition. They don't want to go in and do a knee replacement on those. So we've worked with those patients and they've improved. And that's the biggest thing is we get them up to be a little bit more mobile, a little less pain, and that's the goal.
Yes, any type of I've never been through that myself, but any type of relief I'm sure is astronomical when you've dealt with pain for so long and for such an extended period of time, and to hear you tell the stories that you're working on the people that mean the most to you, your family and your loved ones, and you're seeing these astronomical turnarounds is pretty cool. So let's move on. We've got just a couple, maybe about 5 minutes left here, and I know there's some more things that we want to talk about. You talked about Beth specifically, who is one of your nurse practitioners. Talk to us a little bit about the weight loss and the Botox and anti-aging services that are provided there as well.
Yeah, she's in charge of that and kind of helps coordinate that. We also have another gentleman in there, Dylan, he's a personal trainer.
Okay.
Works with he's done nutrition for years. He helps to oversee that program for us, along with Beth.
Okay.
So he would be the first one to come in and do the consultation with. He sits down for the weight loss and just talks to the patients and see what their goals are and what they're looking for. We've got stuff from if they just want to lose weight from diet. He helps them with that. If he wants, like I said, he's a personal trainer, so he can help set up exercise programs for them. If they want to be a little bit more aggressive and use some different types of medication, that's where he would bring in Beth, and she would talk to them about what their goals are and what they've been on the past, and try not to do the same thing. The goal is to, if you're doing the same thing, not having results, then you change the techniques that you're utilizing.
The definition of insanity, right there. Yes,
exactly.
Yes.
Yeah, and then she does the Botox and the Dysport, the micro. We're building that program. There's a whole lot of stuff that we want to tap into with her program, and we're kind of starting with those, and I've got her plenty busy doing those, and that's just going to continue to grow with that. But the Botox, she's excellent at, and then Dysport is similar to Botox. She does the microblading, and then she does the Juvederm, which makes the lips nice and pretty and thick, and some of those things. So there's lots of techniques that she does that I'm not even familiar with. You want to know the truth?
It sounds like there's so much. I don't know how you keep it all straight. And then massage therapy.
Yep, we have massage therapy. Kelly's been with us for years. I'm looking for another massage therapist licensed, if we can find one, if anybody's out there interested. But she's excellent. Massage therapy goes hand in hand with chiropractic. Everybody comes in, their muscles are achy, they're sore, they hurt. There's nothing better than getting a good massage and then getting an adjustment that helps the patient. It helps to relax them. Their adjustments are a lot better.
Yeah, awesome. So many services and so much to think about. Let's talk a little bit about, here in these last couple minutes, talk a little bit about insurance with all of these procedures. How does that work?
Yeah, most insurances are covered. The ozone, the joint injections, they're not covered. They're not a drug. They're a natural product. Insurances aren't going to cover something natural. They have to have a synthetic drug to cover that.
Okay.
Which drives me insane.
Yeah.
But that's the way it is. But we've tried to make that reasonable so that we can start seeing good results from patients around. We want good outcomes. That's the goal.
Absolutely.
But we are in most insurances.
Okay.
To offer. We have x-rays on site, so I can take x-rays of the patients right away. We always take x-rays before we really start working on patients. It gives me a blueprint of what your spine looks like or your back.
Sure.
And but we are on Medicare, Medicaid, and I think we're in about every insurance in the area.
Okay. And again, we're talking today with Dr. Jamie Gallion of J. Clayton Spine and Health. We're going through a whole plethora of services that they offer out there. Tell us where your office is located, Dr. Gallion.
We're just south of the BP station off Highway 3 on Michigan Avenue. Mm-hmm. The YMCA is kind of right behind us. Yep. We have the little white fence with the green roof there, so we're in the middle of that plaza. Okay,
perfect. And if people have heard us talking today or even in the future through our YouTube channel and they are interested, do they need a referral? Can they just call your office? How does all of that work?
Yeah, you can just call and call the office, make an appointment. We always do free consultations.
Oh, wow.
If somebody wants to bring their x-rays in and we can review those, that's great. That's, the goal is to have good outcomes. If I feel like I can help you, I'll tell you. If I can't help you, I'll tell you that also.
Awesome.
So hopefully we can just give them the answers that they're looking for, and hopefully be able to help them at that point.
Awesome. And I'm going to finish with one last question. What do you think is your most frequently asked or requested piece of information? If you were to think back over the last year or two of all the clients or patients that have come through your door, what do you think is the most frequently asked?
Well, I think people just want to know if they can be helped. I think that a lot of times when you're a chiropractor, I always feel like you're kind of at the end of the road. You went to your medical doctor, your physical therapist, you went to all these other services, and yet you still have some issues. Not that those other services didn't help you, but you just may not be to the point that you want to be.
Okay.
And I think when they come to us, it's like, I just think they want to know, can you help us? What do you see from how would you treat this? How would you go about helping me? And I think you just kind of lay that out. And it can be back pain or headaches. I mean, we have a lot of shoulder pains. Pains everywhere.
Right.
We treat a lot of people with plantar fasciitis, and knee pain and things like that. And these other services that we've gotten into has really opened us a whole can of more things that we can treat. Yeah. So it makes it really cool. But I think people just want to know, honestly, if they can be helped.
Yeah, and you're there to do it.
Well, I hope so.
Yeah, absolutely. Well, thank you so much. This is Dr. Jamie Gallion with J. Clayton Spine and Health, located in the shopping plaza that is just in front of the Decatur County Family YMCA off of Michigan Avenue. I am Dawn Lowe with the Greensburg Decatur County Chamber of Commerce, and this has been Community Connections. And we want to thank you, Dr. Gallion, for being a member of the Greensburg Decatur County Chamber. The whole point of the Community Connections is to talk a little bit more with our members and make sure that our community is aware of everything that we have to offer here in Greensburg, Decatur County, and the surrounding areas. So we want to thank you for your membership. We'll continue to support you and you in the work that you're doing. So thank you so much for being with us today.
Well, thank you for having us.
Absolutely. Dawn Lowe with the Greensburg, Decatur County Chamber of Commerce, thank you so much.